Alright, so we're going to be doing the tracheostomy suction and care video. So I identify the medical record and I perform my hand hygiene. And I'm going to identify the patient. I'm going to state his name since he can't speak, and I'm going to have him squeeze my hand if it's correct. So, Mr. Jones, is that your name? Please squeeze my hand. Okay, so he squeezed my hand, so that's his name. And I administered and identified any need for pain, so I administered the pain medication, allowed that to take effect. And if you need any breaks or anything, this is kind of uncomfortable, so any excessive discomfort, please just squeeze my hand throughout the procedure. And I'm going to auscultate the lungs to identify the need for suction.
Some of vampires saying I don't get more through.
Well, I don't have to take out a dressing.
Let's see, I'd always be working outside.
So definitely the suction. So I'm going to put gloves on.
Verbalize it.
Thanks. Got my gloves on. I have all of my equipment on my table. So I make sure the ambu bag is hooked up to the oxygen and that the trach is disconnected from oxygen. Oxygen's on 15 liters, and I turn on my suction to 150, and then I check my suction to make sure it's working. It's working, cool. All right, bed's at a working height. We're all good, so I'm going to discard my gloves. Perform hand hygiene. Place a chuck underneath him, since it gets a little messy.
Are you just gonna put 2 gauze pads?
Okay.
That's 200, thank you. I should have.
So, put my mask on,
Well, he's not using his breathing.
and I would put goggles on
You can be like, hold on to this.
if I didn't have my glasses, or I would use a purple mask, but they fog and I can't see, so we're gonna leave this on.
That'd be so freaky.
It confused me a lot. It would confuse me a lot.
I'm gonna keep pulling.
Especially like all you remember is you get in a car and you wake up.
Like that one drink video with the old woman, she looked so sick. I felt so bad for her. Like she looked like she was dying.
Okay, now we're ready. So I'm gonna open my
I think she actually might have been a patient.
trach suction kit away from me, and take the little box out. And the outside of it is not sterile, so I can open it and place it as close as I can. And then I'm going to open my sterile saline. So it's been open, but it's not expired. So I'm going to flip it and then pour some in there. Set that off to the side. And then put on, yes, my sterile box.
Like she just looks a very sick patient. So you practicing or are you just gonna dive right in?
I'll dive right in.
You can really practice if you want to hide it all the time. Oh, by the way, Mark,
Alright, so now we're sterile. I can touch this though since this is sterile, so I'm going to take out the catheter.
okay.
And in my dominant hand, I'm going to wrap it.
Like, we need to do that today. We need to go print off, fill it out. And then my dad.
And I'm going to hook this white end to suction. So now my left hand is dirty. And I'm going to undo this and stick it in the sterile saline to check and make sure it's working. I'm going to coil it again, remove my oxygen with my dirty hand.
Well, she's just making sure she has
Making sure everything's
Oh, and then I'm going to
however it gets hot.
recoil and give him some breaths.
Did she check her his ID then?
So 1, 2,
Yeah, because I did say
3. Alright, so now I'm going to re-dip in the saline.
I think that's what I did with the amber.
taut, and with your thumb, going to be occluding it. And so my pinky is contaminated, so I won't stick that. So I'm going to carefully insert the suction, and I'm going to circular motion for 10 seconds. I'm going to repeatedly occlude it and suction. So 1, 2, 3, 4,
Okay, so it is 2 seconds.
5, 6, 7, 8, 9, 10. Okay, and without my thumb occluding it, I'm going to give him some breaths. So 3, 1, 2, 3. Uncoil, keeping my pinky away since it's contaminated. Redip, keep it taut. And again, one more time, insert the suction catheter.
Yeah, I used an editing app.
And 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So take it out, and now we're done with this. Take it out from suction. Take out the inner cannula. And before, I would have suctioned his mouth out after, but yeah, so we did that too. And then take out the dressing. Now I'm going to discard of all of this and reapply oxygen since it's open now. So for the purpose, I'm going to reuse the inner cannula for the video since that's what fits. Discard my sterile gloves. Alright, so I can get rid of all this. We don't need this. Perform hand hygiene, and now after suctioning, I'm going to auscultate the lungs again to make sure they're clear.
100 to 150. No need for here. That's like pretty much.
Alright. Oh god, I'm a mess. So he's clear. So suction was effective. So now I'm going to clean the trach. So I have my trach cleaning kit, and I also have another pair of sterile gloves just in case. I have my emergency kit on the wall. So it has a hanker suction or yanker suction, a new sponge or the split gauze, catheter, collar, and a new inner cannula. So I have all that, and I have an extra trach here as well. So open trach away from me. Going to remove my sterile gloves. I'm going to take this out. I don't need this, so you can use it. You don't have to. Alright, and then I'm going to pour my sterile saline. Flip it if it's open and unexpired, and then if it's new, just go ahead and pour it. So pour it into the empty space. Dump the new inner cannula and put on my sterile gloves.
Well, yeah, no, like you're gonna want to put on the face shield and stuff, like, and then put on the sterile gloves last, because they're sterile, like, you have the opening with it.
And then you like.
Alright, so I put my new inner cannula in. Remove the oxygen, so this hand's going to be contaminated. And wait till you hear it click, and now it's a clean procedure, so I can touch whatever I want with the hands. So I'm going to put, I think I would have put my cotton swabs before I touched it, but we did that. Alright, so I'm going to clean the trach in 4 different areas and then around the plate. So lifting up, you just go 1 here, here, here.
I think I can.
And north.
Yeah, so this is like the container thing.
And you can do it around since secretions get on here as well. Alright. Now I'm going to dry off the trach and around.
Also be getting her stuff.
Discard of that. And apply the split gauze underneath.
Yeah, this is really finally given on
Holding the trach in place. All right. So now I'm going to replace the collar, so I can use this, or if I have another trach collar. So I undo one end, make sure holding everything in place. Take my shoelace where I don't know where it is.
I'm not looking.
All right, so I would tie it over here and then hold it and then tie it here, so you don't want to have both ends untied. And then I would go ahead and re-administer the oxygen, hook the trach back up to the oxygen, and clean up.